Okay, so I told you all that I was just going to take a quick break, and definitely I was going to come back with Dr. Bat. Today is Saturday, and you already know. So every Saturday with the Reason Health Matter, and for a couple of months now, we don't they talk about wetin dey shele, wetin dey affect the world, not just Nigeria, not just Africa. It is something that is global. We dey talk about the pandemic, we dey talk about COVID-19. But Dr. Ba was giving me an update that, okay, last week they started on vaccine. We don't hear so many info on top vaccine, how true it be, how genuine it be, is there any on ground, are they working on some? Is there things that we need to know? You know, in as much as I have my own questions, I have my reservations, but then we'll do all of that later on top of the show. But guys, straight up, let me just welcome Dr. Bat, our in-house doctor. He's certified doctor, person wey sabi, go school, learner. Shop and sleep and drink and everything on top medicine. It is Dr. Bat. Doctor.
You can say that.
I was just stating the
elegant.
Thank you.
Delectable slimity.
Thank you,
As always.
As always.
Representing.
Thank you very much, sir.
Yeah, thank you.
And you look good, by the way. I like your tie. I like
thank
your outfit,
you very much.
Everything.
Two of my children insisted that I must put on a tie today.
Don't you put on tie before? I like...
Once in a while, though.
Okay, so but then they wanted it to look different.
Yes, I must acknowledge them. Kosi Sochuku and Chukwudumbi.
Is it that one that looks like you?
No, that one is nature. Wonderful children. Thank you for all your support.
Oh.
Yes, so good morning, viewers at home and around the world. We're back today on Health Matter. We'll be looking at coronavirus pandemic. It's actually a topic we started almost getting to 9 months now. But this morning, before we start, I'd like to announce a major breaking news.
Now you're getting those
no longer news, okay? But it's something everybody that is an African should be proud of, okay? Africa has been able to eradicate wild polio. Now, this was a disease that was paralyzing at least about 75,000 children in just one single year. So we've been able to eradicate wild polio. Africa has been declared polio-free.
Good.
Okay, so as it stands now, we only have polio existed in just 2 countries of the world, Afghanistan as well as Pakistan. Okay, so we need to maintain the momentum. I also would like to pay homage to WHO and partners. One of the major partners that have participated actively over the last 2 decades to ensure that we realize today's dream is, of course, Rotary International. I'm a proud member of Rotary. I always do my pin here. Okay, so they did so much alongside our icon, African icon, the late Nelson Mandela, Madiba of blessed memory. He did so much over 2 decades ago to ensure that we can see today. Okay. Also, before I proceed on today's topic, I would like to also wish our own very Deputy Incident Commander, talking about the Lagos State Commissioner of Health, in the person of Professor Abayomi, who announced about 4 days ago that he has been infected with coronavirus. When I was reading it, I felt so touched, where he said, at a place where he said that he felt you would have actually have picked this virus much earlier than he did, because he has been exposed countless number of times. That is actually the pathetic situation that a lot of frontline health workers have found themselves. Okay, I'm not just wishing him speedy recovery in isolation. He's safe alongside all other healthcare workers. As a matter of fact, everybody that is currently struggling to recover from COVID-19, we're all wishing you a quick recovery. Okay. That said, today we'll be looking at the subtopic that we actually started last week, talking about vaccine update with respect to COVID-19. I want to start by saying that as it stands now, because of the high level of community and active transmission that is ongoing, keeping in mind the number of affectation on a global level, the only major breakthrough that can actually give the whole of humanity a reprieve is for us to discover an efficient and safe vaccine So all eyes are on vaccine, and that is why today we need to deal with the topic so that at least all our viewers will have the baseline idea of what vaccine is all about and what the production, what it takes to get a vaccine from the lab to the clinic. As it stands as of today, the global affectation by coronavirus at the moment, it has affected 24,920,024 persons. My source is Worldometer. And it has caused 841,486 deaths. What that means is that 841,486 individuals, unfortunately, sadly, have lost their lives to this contagion. Suffice also to say that 17,303,780 persons, almost 17.4 million, have equally recovered. But sometimes when we say the number of people that have recovered, I was watching CNN there some time ago, and Richard Quest, who unfortunately was stricken with this virus, but he has recovered, he said something that got me thinking, that sometimes he still notices some problems. He keeps discovering some new things, okay, new sickness in his system. And of course, I know that a number of people who we believe have recovered, some are still going through some health challenges, one form of health challenges or the other. So there's actually no scientific way of measuring how recovered the so-called recovered people are. So the best bet is prevention. Remember, prevention, they say, is always better than cure. And that is why you and I must ensure that we keep to the government directives to stick to the IPC protocol, infection prevention and control protocols, of course, which entails the use of face mask once we're in a public place, washing our hands, always under running water with soap for at least 20 seconds, and ensuring that we do social distancing, avoiding crowds as much as possible. Okay? Now, talking about the vaccine update, let me also start by saying that the race to get a vaccine actually started sometime in January. And this was made possible because the Chinese scientific community, early on in the pandemic, they were able to do the sequencing, to decipher the genomic sequencing of this coronavirus vaccine. So that helped a lot of scientists across the world to pick up the battle from that point. Okay? So as it stands today, a number of vaccines are at preclinical stage. About 135 of them are currently at the preclinical stage. We're actually going to go through the phases so that each and every one of us will have a clear view of how these things are done. The rigorous process that it takes to get a vaccine. I also would like to point out that coronavirus, being a new coronavirus that we have not had, humans, it has not been found in humans before now, so it was difficult. But what helped the scientific community was the fact that we have dealt with similar coronaviruses, talking about SARS-CoV as well as MERS-CoV, okay, that we saw about 2 decades ago. So already, scientific community have started work. In fact, the work they are doing are already at an advanced stage with these 2 other variants of coronaviruses. So they were able to take it off from an advanced stage. And that is why today we are looking at possibly having 1 or 2 vaccines on our shelf by the end of October, before the end of October this year. Majority of them will actually hit the shelves, hit the medical shelves by the first quarter of next year. Now, what were they able to do? The scientific community were able to identify the protein and the sugars that are usually found on the surfaces of this virus, as well as infected human cells. Okay, so they were able to identify those set of proteins and sugars, and some of the vaccines that are being worked upon today are based on the knowledge they've garnered from these discoveries. Suffice also to say that the talking about the test kits as well as some other diagnostic discoveries were equally based on this. Okay, now let me start by saying that there are two major phases when you're talking about what it takes a vaccine to be developed in the lab before it gets to the clinic. Number one is the preclinical testing or trials. Number two is the clinical testings or trials. Now, the preclinical testings has to do with when a vaccine is discovered in the lab, they will start using them on non-human. They will use them on animals first, usually the mice and monkeys. Okay. Now, when they discover, the essence of doing that is to find out if it will elicit an immune reaction at all. Now, those ones that will survive, those ones that will pass the test at that level, will move over to the next stage, which of course is the clinical trials. And in the clinical trials, you have phase 1, you have phase 2, as well as phase 3. Now, phase 1 has to do with safety trials. Okay? Scientists usually will give such a vaccine candidate to a limited number of people. Okay? To a limited number of people with a view to eliciting the safety, the dosage. Will it require multiple dosing? Will it require just a shot or just a booster dose? All of this will be known at the early stage. And also to elicit if it can stimulate the immune reaction. After that stage, it will go over to the phase 2. Phase 1 at the moment, the preclinical, the update I have as of yesterday from New York Times shows that 89 vaccine candidates are currently at the preclinical testing stage. And of course, we have about 23 vaccine candidates currently in phase 1. Okay, so by phase 2, what scientists will do is to give this set of vaccines to a higher number of people, healthy individuals, usually volunteers. The vaccine is meant to prevent a disease. It's not curative. It's not a drug. It's not therapeutic. Okay, so it's given to healthy individuals that have volunteered themselves for trial. So phase 2 will require giving such a vaccine to hundreds of people. Again, they will be looking at safety, they will be looking at dosage, and they want to see the degree of immune response that such a vaccine can elicit. If it passes that stage, it will move over to phase 3, which is usually the final phase. And as we speak today, about 14 vaccine candidates are said to be on phase 2, which of course is called the expanded trials. Also on phase 2, the volunteers, the healthy volunteers, are usually divided into two: the children and the elderly, with a view to discovering how the vaccines will work in these different age groups. Okay, so when we get to the next phase, which of course is usually the final phase, the efficacy trial stage, that's talking about phase 3. Okay. The scientists will give those vaccines to thousands of people, usually over 10,000, 30,000, or up to 50 to 60,000. As we speak, that is currently ongoing in a number of countries. In South Africa, our own South Africa, such trials are ongoing. In Brazil, in US, and Germany, and a number of other countries. Okay, now, the phase 3 will require using these vaccines on a large scale. Okay, usually, the people the vaccines will be used on will be divided into two. Okay, the healthy individuals that volunteered themselves. Oh. The vaccines will be active vaccines will be given to half of them. About half of them will receive placebo. Okay, we'll continue from here when we come back.
Okay, so just like he said, we need to go for a quick break. When we come back, I'll be opening the phone lines and you can start calling to ask your questions. Stay with us. We'll be right back.
Health
Health Matta na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top we health matter. You fit interact with us on top the show or talk to the doctor through we phone numbers wey be 08173147589 and 08105434984. You still fit call us on top with Skype ID wey be WAP TV. You fit also advertise your product and services on top we show wey dey help people. Terms and conditions apply sha o.
Babarisi, you been dey sleep when government motor show for inside area this afternoon o. Now so them take enter Sisi Clara house wey dey the other side. They come comot with some kind medical equipment. But e be like say she don catch the coronavirus wey people dey yarn about o. We sef we no safe for inside area again o. Kai! I no go even pass that her house again.
Mama Risi, haba. Shey you no know say e dey good make government to check everybody wey they suspect say they don contact with people wey don carry the virus? E no mean say dem get am now. Even if to say the person get am, e mean say dem go just carry am make e collect treatment. If person get the coronavirus, e no mean say the person don die. Person fit still recover, or when they don suspect say somebody get am, dem go do test. Dem fit even treat the person fast. Plenty people wey catch the virus, after dem collect treatment, dem recover. When these government people come, make we allow them, make them test you.
This message now from the Federal and State Ministries of Health, Ministry of Information, NCDC and them partners them.
Everyone has to wear a face mask to reduce the spread of COVID-19. Wearing face masks appropriately can help prevent the spread of COVID-19. So the more you wear your face masks, the better. Whether you are on your way to work, the market, or the bus station, always wear a face mask. When an infected person coughs, they spread tiny droplets filled with the virus into the air. Wearing the mask helps to reduce the amount of virus being spread by an infected person. When wearing a face mask, make sure it covers your nose and mouth. You do not wear it on your neck or under your chin. Avoid touching your mask often. Dispose of it hygienically. Face shields will not protect you from COVID-19. Avoid wearing them. If you must, always wear it with a face mask. Take responsibility. This message is brought to you by the Presidential Task Force on COVID-19.
Hello, today I'd like to talk to you about how to wear a non-medical mask, also known as fabric mask. Fabric masks can be used by the general public in areas where there are many people infected with COVID-19 in the community, and physical distancing of at least 1 meter cannot be achieved. There are a wide variety of fabric masks that can be handmade or purchased in a store. They act as a barrier so that you can protect those around you. They should ideally be made of 3 layers of fabric. The outer layer should be a water-resistant fabric. The inner layer should be water-absorbent, and the mid-layer acts as a filter. First, clean your hands with alcohol-based hand rub or soap and water. Pick up your clean mask and inspect it. If it is damaged or dirty, do not wear it. Place the mask on your face, covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. Do not touch the mask while wearing it to avoid contamination. If you accidentally do, clean your hands. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. As you remove the mask, lean forward slightly and remove the loops from behind the ears without touching the front of the mask. And don't forget, wash your hands after taking off the mask. Make sure that you have your own mask and do not share it with anyone. If your fabric mask is not soiled or wet and you need to reuse it, You can store it in a clean plastic resealable bag such as this one. However, if it is dirty, do not use it. Wash it with soap and water, preferably at high temperatures after each day of use. Remember, a mask alone cannot protect you from COVID-19. It must be combined with protective measures, including maintaining at least 1 meter distance from others and washing your hands frequently. Stay safe and help prevent the spread of COVID-19.
Okay, just beating the drum to what she said. Stay safe.
Yes,
it's really, really important. I'm going to open the phone line straight up. Of course, you already know what we're doing. We open our lines. That means you get the opportunity to ask questions. Dr. Bali talk about vaccine this morning. You don't tell us how the process be waiting there on ground. It's a delay. Obviously, I know I get questions relating to that. But the numbers are on your screen: 08105434985, because 08173147589. Please feel free to add us up on Skype at WAP TV. You can just search for us, and then we'll get to see your faces this morning. Doctor, before I'll come to vaccine questions. So this morning, our question on the breakfast show was why some persons have not had their COVID-19 test. And most of the feedback so I've been getting from my viewers, and I say, okay, some persons are like they are scared. I was thinking they're going to even complain about the money and stuff. So some are like they are scared. Some are like time and all of that. And then some people feel, say, if they go to hospital, say possibilities, they make them exchange their result. And they do not want what is not theirs. And that what you know most times will not kill. But then I think immediately you start getting worried and all of that. So I don't know. So I told them I was going to take Dr. Bath if you can help me advise them to go for their test. And then that's one. Secondly, how cheap is it?
Thank you very much. Thank you very much. I was wondering while you were asking the question.
I needed to ask because it's only just one person.
My focus was on the B part of it.
Okay, which is
yes, the cost implication. Okay. The cost implication. Now, let me start by saying that truly and sincerely, in no distant time, it may not be up to the next 1 or 2 months, Nigerians, and of course, indeed, the whole of Africa will be able to go for the test willingly, without much difficulty, without much hassles. Okay, I say this because recently, one of the rapid test kits that can check the result, that can test somebody on the spot, okay, produced by Abbott, has received FDA approval in the US. As a matter of fact, US government has requested for $150 million of that test kits. By the time you start getting to some other countries of the world, facilities, hospitals, diagnostic centers, a lot of them will be able to get into the testing business so that people can walk into any place and get tested without hassles, without having to wait for several hours or even days for 30 hours, as we currently have at the moment. Now, the question that she asked, I will approach it in 2 ways. Number one, in Nigeria today, the testing category are in 2 ways, the A part and the B part. Now, the A part is for people who have health concerns, who need the test. This set of people need to be tested. And so government does it without collecting any amount of money from this set of people. So it's done free for this category of people. Now, the second category of people are the people who want to just walk in and get tested. I want to know my status. Just like somebody who say, I want to know my HIV status. Sometimes it could be a requirement in the office, or for traveling purposes. People who want to travel out of the country may be asked to get such a test. Those set of people are not being tested by the government at the moment. Those set of people will have to go to the private labs to get tested. And of course, I do also know that at the moment, government has paid such tests. We have Dr. Koye from Anambra State. Oh. Dr. Koye, good morning.
Your doctor colleague.
Good morning.
Yeah, good morning, my brother.
Hello?
Hello, we can hear you.
Doctor. Good morning, doctor.
Yeah, good morning.
Good morning, sir. Please go on.
Good morning. I'm Dr. Omobi Okoye from Anambra State.
Good to have you on the show.
Yeah,
Please
thank
go
you
on.
very much.
Yeah. Please, I want to, from the statistics, from the daily coronavirus statistics that we are getting, I can see that the number of cases, the daily cases are falling.
Yes, yes.
Yeah. Okay, so what's the question?
Any other question?
Daily cases are falling. So
Yeah.
I want to know whether we have reached the peak. Have we really reached the peak?
Thank you very much, sir.
Yeah, no other question. That's what I want
All
to
right,
know.
sir.
Thank you for
Okay,
calling in.
Abby.
Yeah, thank you. Very important question.
You actually
like that.
said that too this morning, that I think we had the lowest number.
As a matter of fact, just to add to what he has just said, over the night, the new cases confirmed in the country was 160. 100 plus 60. The last time we had a figure, anything close to this, should be like 5 or 6 months ago, if I'm not mistaken. Yes, just in line with what he has said. Okay? Yes, you can see it on our screen. The technical team, if it is possible, I'd like you to just flash through the past case loads that we have had in the last couple of days. Okay? Now, just in line with what he has said, I want to quote the Lagos State Commissioner of Health. He said that Nigeria has gone past the peak. Okay? That any moment from now, we'll start seeing the figures descend. But I don't want to just look at it from that angle alone. I do know as a doctor that the more we test, the more we discover. Okay? Now, that brings me to the fact that in the last couple of days, Plateau states appear to be leading the pack, at least in Nigeria. In the last 24 hours, Plateau State recorded 44 new cases, while Lagos, that has been the epicenter, recorded over just 27 cases. And I think yesterday again, Plateau State led. Now, why was this so? It was so because they've been able to increase their testing capacity. So any state that has been able to ramp up its capacity to test more people will ideally discover more. Okay?
So are we saying that it's because maybe there are
one of the reasons is because at the moment we are not testing as much as we should do. Yes, there has been a number of improvements. We have gotten to somewhere appreciable that we all should be proud of. It took a great deal of effort to get there, but we are still not testing enough. You can see the figures on the screen. At the moment, Lagos State has a total of 18,083 cases, followed by FCT, and of course, Oyo State, Edo, and Plateau. Plateau has come to number 5 because they've increased the number of their testing capacity. Also, because I'm dwelling on testing, South Africa, that is topmost in Africa, with a caseload of 620,132. Okay, South Africa has tested 3.6 million. Okay, Egypt has tested about 135,000. Morocco has tested 1,868,545. Nigeria coming in the 4th place with a caseload of 53,477. Of course, we have said that we had about 160 new cases over the night. Nigeria has tested 394,524 persons as we speak. Okay, so the number we have tested is just like a drop in an ocean. So we need to do more. I believe the more we test, the more we will discover. But what is significant? What I want to note is the fact that, truly speaking, for whatever reason, the scientific community have been able to attribute this to a number of reasons. We are not seeing the level of casualties, the level of fatalities that people predicted that we were going to see in Nigeria. Not just in Nigeria, as well as some other West African countries. And of course, we have adduced a number of reasons. Okay, from a scientific point of view, it could be, one, because of the fact that most of the African countries, including Nigeria, has more of youthful population. Don't forget, life expectancy in Nigeria is said to be in the neighborhood of 55 point something years or so. Okay, so because we have a youthful population, and we do know that one of the risk factors for COVID-19 is advancement in age. So people who are advanced in age are more likely to have a number of health baggages that they may have carried along in their lifetime. Talking about comorbidities like hypertension, diabetes, and some other heart conditions. Okay, so this can predispose people to having, and of course, keep in mind that this set of medical conditions are found more in the elderly than in the young. Another reason that has been adduced too is the fact that vitamin D was implicated. They discovered that the disproportionate amount of deaths they were noticing in the US among some certain tribes, talking about the blacks in the US, they were dying disproportionately as compared to some other tribes in the US. They discovered that those individuals were found to have vitamin D deficiency. And you and I know that in this environment, what we need to get vitamin C is to just to come out in the early morning sun. And of course, we have an abundance of that
everybody
in
can
this
come
part
out
of
and
the world.
enjoy.
So these and several other factors have been adduced as part of the reason why we are not seeing high level of fatalities. Okay, so that is what I can say along that line. Now, let's go back to the vaccine that we talked about. I think we left it at phase 3. Okay, so the phase 3, which of course is the efficacy trial stage. At this stage, scientists usually will give vaccines to thousands of people. I've said that before. Usually divided into 2 groups. First group will have the active vaccine. Second group, without their knowledge, will have a placebo. So over time, these people are monitored to see how many of these group of persons that are being tested will pick up the infection. Okay, so that they will be able to know whether the vaccine is effective or not. Suffice to say that we may not get a vaccine that will be 100% efficient. Okay, I also would like to point out that it is difficult to get a vaccine that will be 100% effective. Measles vaccine, as effective as it is, 3% of people who have had measles vaccine may still end up having the infection. The vaccine for whooping cough as well. Okay, a lot of people who had the vaccine, yes, they may not fall sick, but they can still transmit it to others. But the scientific community are saying that if we can get a vaccine that will be about 50% efficacious, that will be good enough, at least for COVID. Kelly from Edo, good morning.
Kelly, good morning.
Good morning, Mada. How are you?
Very well. Please turn down your volume. Help me with your TV volume, please.
Okay.
Thank you. Now go on.
Good morning, madam.
Good morning, sir.
Okay. Are you okay now?
Yeah,
Yes,
very
yes,
well.
yes.
It's
You can go
fine.
ahead.
You can go on.
Okay. Please, doctor, I want to know the mode of testing COVID-19 patient. Is it by taking blood sample or I don't know, is it swab? I don't know what they used to test the COVID-19 patient. And the hearing of people dying of this COVID-19, it will not really see patients that actually die of that illness. And you also talk about those people that is prone to COVID-19 is prone to those people that have diabetes and terminal disease. What and you report in time, will that person still die of COVID-19? So these are a few questions I want to know more about. Thank you.
Okay, thank you very much. Now, let me address the first one.
Mode
of testing. Okay. Now, the mode of testing for COVID-19, let me limit it to what we can presently do or what is acceptable in Nigeria at the moment. Okay, so basically, we have at the moment, Nigeria had gotten to a stage where we can confidently say we have about 64 molecular laboratories scattered all over the country. As a matter of fact, some states have up to 3 or 4. Edo State just commissioned, I think they should be more than 64. Edo State governor just commissioned a private lab just yesterday. They are doing fantastically well also in that state. Now, the mode of testing, the diagnosis, the way to diagnose COVID-19 in Nigeria is by doing a real-time PCR testing. polymerase chain reaction, okay, testing, which of course will take 24 to 48 hours for an individual to get the results. What samples should be collected? Sputum can be collected, okay? Nasopharyngeal swab. Sometimes you see people being pictures of people where samples are being collected, being taken. You see them putting something in the person's nose and mouth, okay? That is through the nose, nasopharyngeal. Through the mouth, oropharyngeal swab can be taken, okay? Now, in some people who may be sick enough that they may not be able to produce samples through these methods, okay? That may not be able to produce samples through this method, they can do tracheal washout, okay? That can also be used to do tests. So at the moment, those are the methods that are being used to do tests in Nigeria. I also want to add that a number of gene expert machines that I think we have about close to 400, if not more, in Nigeria. A good number of them have been converted, reformatted in quotes now, to test for COVID-19. And with those set of machines, we are looking at getting results a lot faster than we are currently doing at the moment. So those are the methods of testing.
Okay.
Thank you very much. Now, I also want to go back to the vaccines that we talked about. And I want to say that we have majorly 4 types of vaccines. We have genetic vaccines, the so-called nucleic acid vaccines. And then we have the viral vector vaccines. And then we have the protein-based vaccine. And the last one is whole virus vaccine. Now, I will explain. The 4th one, there are others, other than these 4. We talked about repurposed vaccine last week. Now, the whole virus vaccines are actually the virus itself that has been weakened, that has been attenuated. Okay, so that's the word. Okay, now, in such a way that if it is given to an individual, they are called live vaccines. Measles is a good example of such a vaccine. Now, if you give it to somebody, it is the virus itself that you're giving, but the weakened form of that virus that you're giving to such an individual, it has been inactivated in the sense that it can only elicit.
Okay, let's take Grace. Grace from Ekiti. Grace, good morning.
Good morning.
How are you doing there?
I'm fine.
All right, please go on. Do you have questions or contributions to make?
Yes.
What did you say?
Morning,
no, she's still on.
Okay.
Yes. I want to talk to contribution.
Turn down your volume.
Yes, go ahead.
Right. Can you turn down your volume and then go on?
Contribution about coronavirus pandemic.
Yes, go ahead. We can hear you.
Hello.
Yes, we can hear you, ma. Go ahead.
Hello.
We hear you. Go on. Or just call us back. Thank you. Okay.
Yeah, so the whole virus vaccines are the ones that have been inactivated. Okay? They are given with a view to eliciting an immune reaction. Okay? We'll go on this break when we come back.
Yeah, we'll be right back.
Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top we health matter. You fit interact with us on top the show or talk to the doctor through we phone numbers wey be 08173147589 and 08105434984. You still fit call us on top we Skype ID wey be WAP TV. You fit also advertise your product and services on top we show where they help people. Terms and conditions apply, sha o.
Good afternoon, Auntie.
Hello, John. How are you? I see you're not wearing a face mask. Do you know the risk of getting infected with coronavirus is very high when you don't wear a face mask while outside or in public places?
But I'm young and very healthy. I cannot easily be infected with the virus.
Anyone can be affected with coronavirus if not careful. One of the most effective ways to prevent the spread of coronavirus is by wearing face masks. This ensures that persons infected with coronavirus do not easily infect others. You can use any type of mask available to you. Just make sure You clean your hands with alcohol-based sanitizer or with soap under running water before wearing your mask. Cover your mouth and nose with the mask. Avoid touching the mask while using it. If you do, sanitize or wash your hands with soap and water. Replace the mask with a new one once it is damp. To remove the mask, pull it off from behind. Dispose single-use mask immediately in a closed bin. And clean hands with alcohol-based sanitizer or soap under running water.
This message is brought to you by the Adamawa State Ministry of Health in collaboration with UNICEF.
Medical masks should be worn by health workers and those caring for someone with COVID-19 symptoms, persons aged 60 and over, and anyone with pre-existing medical conditions, as they are at greater risk of developing serious illness, and people who have symptoms suggestive of COVID-19. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. Inspect the mask for tears or holes. Do not use a mask that has previously been worn or is damaged. Verify which side is the top. This is usually where the metal strip is. Identify the inside of the mask, which is usually the white side. Place the mask on your face, covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. Pinch the metal strip so that it molds to the shape of your nose. Remember, do not touch the front of the mask while using it to avoid contamination. If you accidentally touch it, clean your hands. Now, how do you take off a medical mask? Before touching the mask, once again, ensure that you clean your hands with alcohol-based hand rub or soap and water. Remove the straps from behind the head or ears without touching the front of the mask. As you remove the mask, lean forward and pull the mask away from your face. Medical masks are for single use only. Discard the mask immediately, preferably into a closed bin. Clean your hands after touching the mask. Always be aware of the condition of the mask. Replace it if it gets soiled or damp. A mask alone cannot protect you from COVID-19. It must be combined with other measures, including maintaining at least 1 meter distance from each other, washing your hands frequently, and avoid touching your eyes, mouth, and nose while wearing a mask. Stay safe and help prevent the spread of COVID-19.
Do all you can to stay safe so that the numbers will continue to decrease, and obviously we're hoping for a COVID-19 free world. All right, so doctor, you don't talk so much about vaccine, but then I get something to ask. So we here say one vaccine, don't they, like that, ahead of, I think, Russia and China. You didn't say anything about it. Okay. And then what is the type of vaccine? More even know. They want to really know if there's hope for us. Are we hoping for a vaccine? We heard there's one ahead of that of the US. What do you have to say about it?
Yeah, thank you very much for that very important question. Let me start by doing a recap. I said majorly that there are 4 types of vaccines that are currently being worked upon. There are others, okay, but the major 4 are the genetic vaccines, the so-called nucleic acid vaccines, talking about the DNA and the messenger RNA vaccines, okay? Now, after that, you have the viral vector vaccines. After the viral vector vaccines, you have the protein-based vaccines, and of course, the whole virus vaccine, which of course I was trying to describe. The 4th one, in which case you have the an attenuated or weakened or inactivated form of a live virus being injected into humans to elicit the immune response that will bring about protection. Remember, healthy people are giving vaccines, not sick people. Okay? Now, coming to her question, it is true that 2 countries have actually given an emergency approval to 2 vaccines, Russia
and
as
China.
well as China. Okay, but that's not a formal approval.
Okay, Engineer Ola is calling us from Bauchi. Engineer, good morning. Hello, Engineer.
Hello.
Good morning,
Good
sir.
morning, sir.
Good morning.
How are you doing?
I'm doing fine.
All right, please go on with your question.
Good morning, madam.
Good morning.
Hello.
Please turn down your volume. Help me turn down your TV volume.
I'm doing fine.
Turn down your TV volume and go on.
Please, my contribution pertaining is that
Go ahead. We can hear you.
This is very loud, extremely loud.
I think we lost the
Okay, yeah, he has to call us back. Please, when you call us, turn down your volume so that we can hear you well. When it's too loud, definitely we can't get anything you say. All right.
Yeah, so the viral vector vaccines are actually the type of vaccines that they gave emergency approval for. Okay. Now, that of Russia was announced by the president of Russia. I think it was on 11th of August. Okay. Now, but the scientific community, they were not comfortable with the quick approval given to at least that of Russia, because they hadn't at that time, at the time they made that, they gave that approval, they haven't started doing the final phase of testing, of trials, which of course is the phase 3. Now, that vaccine was made by Gamaleya Research Institute, okay, and that vaccine was named Sputnik 5, okay. Now, it's a combination of 2 adenoviruses, okay, AD5 and AD26.
Okay, Bamdele from Lagos.
Good
Bamdele,
morning,
good
sir.
morning.
Okay. Good morning.
Good morning. How are you doing?
I'm fine.
All right, please go on.
All right. I think I just want the doctor to clarify this issue and possibly if there's any way out to get out of it.
Okay.
There's a situation of somebody who was tested and I actually complained of one ailment or the other, was tested and the suspect that the person is having traces of COVID, and she was put in the isolation center, and then waiting for a result to come out. But along the line, we were told that while in isolation center, she wasn't given any treatment at all. I'm trying to see any way that getting the result for the treatment comes out faster in a way that the health of the patient will not be in jeopardy. We were told that before the result came out, the woman died of another ailment entirely, which is not actually COVID-19. Possibly, if the result has come out much more faster,
they would have
been treated for the particular ailment that she was actually suffering from. I remember the doctor talk of maybe the result comes out maybe 24 hours or 30 or whatever. Is there any way of speeding up the testing in a way that the result can come out more faster so that it can save life of more people? Thank you.
Thank you very much. Thank you very much for that very important question. Yes, I've also had experiences along that line. As a matter of fact, one of my patients who was tested at a time early on in the pandemic, she got across to me and then I gave her the numbers to call and she reached out to them. They answered promptly. And of course, she was tested. But it took up to 6-7 days before she could get results. We encountered some challenges at a period of time. We had a lot of backlogs at a period of time in Nigeria. Don't forget, the whole of the universe were chasing for the medical consumables. Everybody wanted to have a go at it at the same time. So at a time, we had a lot of scarcities, talking about the testing materials, and of course, it hampered a lot of efforts. But all of that are beginning to change now. People can get their results a bit faster. If the rapid diagnostic test kits that was recently approved in the US, by the time they start getting into the country, we will be able to get results within minutes. Someone can be tested and he or she can get his or her result within a space of less than 30 to 20 minutes. Okay, so we are looking forward to that. It's something that could happen in the coming months. But as it were at the moment, the methods that we are using to test, the earliest anybody can get his or her result is 24 hours. Okay, now coming to the fact that the person who was taken to isolation center said he or she was not given anything. Yes, it is possible. Don't forget that more or less what we do at the moment is symptomatic treatment, okay? Because we don't have some specific drugs that can actually cure and treat completely. However, all of that are also beginning to change in the sense that there are 2 drugs now that we're undergoing trials but have been giving very good promising results. Remdesivir has been used to get good results in a number of patients, but it is very, very expensive. I was listening to yes. I will give you an idea. I was listening to a very good friend of mine who has been to this show a couple of times, talking about Dr. Yomi Johnson. Okay, so he granted an interview where he gave an idea of how much it costs to get Remdesivir. He said a COVID-stricken patient that will be in need of ICU care will require about 11 to 12 doses. And a single dose goes for as much as 400,000 naira. It's a lot of money. Okay, so you can see it's beyond, it's absolutely prohibitive, out of the roof. Not too many people will be able to afford care at that level. Okay, so that said, a good number of people that may be stricken with this virus may have little or no symptoms. They may have just mild disease. So it is possible to get such a person into an isolation center for just symptomatic treatment. The person may not have elaborate treatment being given to such a person, and the person will recover over time. Suffice to also point out that that is also now possible. People can do home treatment. Okay, our Lagos State Commissioner of Health, who recently announced his positive status, is not in any of the isolation centers. He's taking his treatment at home. So a lot of Nigerians are doing home-based care. The protocol has come from NCDC. Now, one of the reasons why people have to be taken out of their normal environment is to prevent them from infecting the people around them, their loved ones, their family members. We've also heard of stories of someone who was infected and ended up infecting the entire family. Okay, but if such a person is promptly isolated, okay, at the nick of time, the person could be taken to an isolation center that will spare the family the other members of the family from getting infected. Okay, so it is possible for someone to be taken there, and not, as a matter of fact, majority of people that may get infected with COVID-19 may have little or no symptoms. They may not even require hospitalization to recover. Okay, so they can recover by themselves on their own. But it now depends on how strong, how robust such an individual immunity is. Okay, these are some of the things that can count.
Okay, doctor, you're not the one by vaccine.
Okay, now the type of vaccine, vaccine that was approved by Chinese and Russian authorities actually belong to the category called viral vector vaccines. The one I said, that of Russia, has 2 adenoviruses. That's for medical-oriented people combined together. While that of China, which is being made by Casino Bio, okay, so that one has just they named the vaccine AD5. Okay, those vaccines have been given emergency approval, despite the fact that they have not completed. In fact, the Russian own had the approval when they have not even started doing phase 3 trials. And that is why scientific community said that the processes were rushed and it could pose a risk for individuals. However, genetic vaccines appear to be the one that is given the most promising result. And we have a good number of them that have gotten to advanced stage. The one that is being made by Moderna Therapeutics, a firm in the US, okay, as well as the one that is being put together by a combination of 3 big pharmas: BioNTech from Germany, Pfizer from US, as well as Fosun Pharma from China. Okay, so you can see there's a lot of accelerated effort. People are synergizing, coming together, okay, to meet up. And we are looking, this one I talked about last, they've promised that by the end of, before the end of next year, they will be able to produce 1.3 billion vaccines for the use by the whole of humanity, not just for the countries that have entered into deals with them. So a whole lot of things are happening in the vaccine, in the vaccine area. Okay, and of course that is good news, because as it stands, that is the only major breakthrough that can help us to return to normal life. Otherwise, we'll still continue with this for the foreseeable future.
That's not a good one.
Yes. Yeah.
That's not a good one.
But we have to be honest with ourselves, and that of course reinforces the fact that those of us who think that COVID has left us, that there is no COVID in Nigeria, like I said at the beginning, the people that recovered, they're still having some form of challenges. So it's better for one not to get infected. Okay, so that is the reason why you should still need to be obeying the government directives, okay, which of course include the use of face masks at all times when you're in public space, and then avoiding crowds as much as possible, and then maintain social distancing. It's now a personal battle, okay? We all need to take responsibility as individuals now, okay? It has gone past the time that we were waiting for government to do this for us and to do this for us, because anybody can get infected. The COVID-19 pandemic, the virus does not respect barriers, does not respect status, does not respect anybody, does not respect countries. Okay, so anybody can get infected. And of course, we have it and still have it in Nigeria.
Thank you very much. And we still have it in Nigeria.
Without a doubt.
So they know. All right, so thank you so very much, Doctor, for
thank you, Slimmy,
always coming to enlighten us. We need to go. Thank you to everybody who watch us. I'll see you guys next week.
Thank you very much.